Good morning. My name is Daniela Elena Costea and I'm professor in tumor pathology at University of Bergen and Haukeland University Hospital. I am also trained as a dentist and my research field is oral cancer and global oral health. Today I will present to you a few aspects of oral health of migrants. Oral health is a key indicator of overall health, well-being and quality of life. There are many studies that are showing a strong relationship between oral and general health. It encompasses not only teeth, tooth decay, or tooth loss, but it also comprises gum diseases or diseases that affect the tissues surrounding the teeth, including oral cancer, which is a life-threatening disease, but also including some other infectious diseases or even birth defects that might affect both soft tissues and bone. I don't know how many of you know that oral diseases affect almost half of the world population, and untreated dental caries are among the most prevalent non-communicable diseases. They affect 35% of the global population, and we are talking about untreated dental caries, not treated dental caries. Even a small lesion on a frontal tooth, like you see here, a very well-known actor, even if it's very small, it can affect many of our vital psychosomatic functions like speech, nutrition, mental state, the self-confidence, because it affects the way we look. And then it affects the quality of life, the ability to work and go to school, and the well-being in general. I mentioned oral cancer, and oral cancer is one of the most serious conditions of oral health. It is quite prevalent, not in the Western world, but particularly in Asian Pacific countries. Oral cancer is among the top 3 of all cancers. And the problem is not only that it's a life-threatening disease, but the consequences of even small lesions, like you could see here, a small lesion on a tongue, can lead to removal of even half of the face. That would have major consequences for the patient and for its life afterwards due to the mutilation. Notably, oral cancer is a preventable disease, so there are small lesions in the mouth that can be detected and treated before a full-blown lesion of oral cancer that is very difficult to treat and has major consequences for the patient. While the oral cancer incidence is increasing over the world, the oral disease in general, the prevalence is pretty constant. However, the burden due to oral diseases is increasing, and this is alarming. It is increasing because it follows the trend that the total population, the increase in total population of the world is following, and oral diseases is a major component of the non-communicable diseases. So it is increases and it poses a major burden of disease, and that's also because it is a very expensive disease to treat. In some parts of the world, oral health is actually a luxury. In Europe, the expenditure on dental diseases ranked only third behind diabetes and cardiovascular diseases. It has been estimated that overall, if treatments will be available for all, the cost for dental caries in children only would exceed the total healthcare budget for the children. So in general, we have a big burden of disease due to oral health and big challenges that the health systems globally and in every country has to face. And the oral health status of migrants seem to be even a more challenge. There are many studies, here I picked one from the United States, which shows that oral health is one of the greatest unmet health needs of migrants. Migrant workers experience 150 to 300% more decayed teeth than their peers, and also their children are affected more than the children of the residential population. And there are many barriers to receiving healthcare in general, but also oral healthcare in particular. I picked another study that shows basically the same, that the migrants have a higher rate of unmet general health and dental needs. They go less to visit a dental office, they are less likely to have insurance, and their children are also affected in the same way. This is a study from Canada where they also identified the barriers that a migrant faces while taking care of his or her oral health. The financial barriers, the language, the cultural barriers seem to be more specific for migrants than for the general population. I picked this study because I like the perspective the authors had, integrating oral health into the circle of integration of migrants into the Canadian society. So, if we start with the aspirant, who is a person who wants to immigrate to have a better life. It immigrates, and health is very important for its full integration. So it will be a symbiotic relationship in which both the migrant and the society where the migrant comes will benefit. However, due to several barriers to oral health access and deteriorating oral health, this circle can be disrupted and then no symbiosis will occur. And as I said, there are many studies that show that the refugee and migrant populations have a higher burden of oral diseases and limited access to oral health compared to even the least privileged populations in the host countries. There are actually encouraging studies showing that there are minimal strategies like preventive strategies that can have tremendous impact and outcome for the oral health. And I will present to you several studies showing that actually the oral health status initially of the migrants is actually better than in the residential country. However, it deteriorates quite often. So I want you to also notice that most of the publications, almost 90%, are from industrialized countries, while the majority of the refugees and migrants are actually resettled in developing countries. And here are just two examples of studies showing that actually there is a low prevalence of dental caries and oral health problem among recent migrants, but they increase with time and the oral health status decreases rapidly. There are also some particular aspects I want you to be aware of when one is thinking about the oral health of migrants. For example, dental fluorosis, which can affect the whole dentition of a person, for example, that would come from Ethiopia. This is due to high fluoride content in the water, and the emulum of the teeth is affected. It is not a sign of, for example, child abuse or negligence. The same is the traditional practice of removal of the canine tooth that occur in countries like Sudan, and these persons will have missing a very important tooth in their dentition, which is the canine. So when meeting a person with this condition, one has to take into consideration the whole context and the background of that person. The same when one could see some lesions in areas which are not exposed to trauma and could be an indication of domestic violence and abuse, like it's this lesion due to coining. Coining is rubbing a coin in an area which is painful, and if it comes under the mandible and someone sees this, one might suspect a domestic violence lesion. However, again, take into account the whole context and the background of that person before jumping into the conclusions. One last aspect that is related with migrants and related to oral cavity, teeth, and oral health is the fact that in the past, dentists have used x-rays of teeth to establish the age of a person, particularly a person seeking refugees. And depending on if you would fall into adult or a child category, different laws will apply to that person. Nowadays, that method has been shown not to be accurate because there are big differences between the biological age of a person and the chronological age. So it is not a method to be used to decide the fate of a person. Here, for example, I want to exemplify that if one looks at the wisdom tooth, one can fail miserably in predicting the age of that person if doesn't take into account that that person might come from a South African descendant or has a Japanese descendant. These have been the few aspects I wanted to bring to your attention in this lecture on oral health of migrants, about the importance of the oral health for general health, about few global trends and challenges of oral diseases in general, and about oral health status of migrants in particular, and I brought to you some aspects, very concrete, about oral health in migrants. Thank you for your attention.